Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in. Hello and welcome to another episode of the INS Infusion Room. Today we have very special guest Carla Dillard in the studio today. Welcome, Carla. How are you today?
Hi, Derek. I'm doing well. Thank you. Thanks for having me.
Absolutely. For those of you who don't know, I've known Carla for a little while now. I've had the pleasures of working directly with her. So excited to have her in the studio and share some of her wisdom and knowledge today around a very important topic. We're going to be discussing some recent changes in the scope of practice for nurses in Louisiana that she's very excited to announce and talk about. But before we get started in that conversation, Carla, do you mind to provide a little bit about yourself?
Thank you, Derek. I started my adventures back in 2005 with Dynamic Access. From there, our company has grown significantly over the years, which included multiple states bringing into our organization. So currently, we are providing services throughout 24 different states, and I operate as the senior clinical advisor for them to date for both the dynamic access and the dynamic infusion side of our organization.
I know along the way you've led so many changes, not only for the organization, but as you approach each new geographical region, you've had impact across the nation. So thank you for your huge impact and work that you've done so far within the vascular access and infusion sector. But most recently, we've had some change in Louisiana scope of practice that you championed for, and that is expansion to include ECG technology for the use of registered nurses in the state of Louisiana. Is that correct?
That is correct. And this has been an
Woo-hoo!
ongoing project for many, many nurses, including all of the nurses and advanced practice nurses throughout the state of Louisiana, for sure.
So what brought this to your attention that the change needed to occur, or where did this begin?
Yeah, so this actually began back in, I would say, around 2011. As I mentioned earlier, we work out of multiple states to provide vascular access services. Within each state, multiple challenges occur. Within the state of Louisiana in particular, it was one of our first states to move into. And in 2011, we began utilizing the technology throughout our other organizations throughout other states. Louisiana had within their Louisiana Administrative Code, and we can explain what that all is in a minute, they had a provision in there that was specific to PICC lines, PICC line insertion, and who could be the persons to read these lines or clear these lines for use. Within their specific administrative code, it made a note that prior to initiation of therapy, the catheter tip placement would be determined by a physician or advanced practice registered nurse via radiology or chest x-ray to confirm tip location. In many states, that was the gold standard for a very long time. Now, from the research that we've done, we understand that as early as the 90s, we could see entities out in California using this approach. And then, of course, some of our vendor partners came out with new technology to adapt to our PICC lines. And with that process, we saw Louisiana still lagging behind. So the first approach to the Board of Nursing in Louisiana was done in 2012 by a petitioner named Carol Gonzalez. And she was there was a group of them. I'm not sure how many were included in this group, but there was a group of them. She is now retired, a lovely lady, and thankfully got to work with us. Even though she's retired, we brought her back into the organization to help get this pushed through at the last minute. So Carol Gonzalez started the petition in 2012, took it to the Board of Nursing, and at that time and multiple times since then, it was not approved to move forward. So we should circle back to the Louisiana Administrative Code and how things operate in
Yeah.
Louisiana.
Yeah.
So within Louisiana, or with any state, you're challenged with understanding your Nurse Practice Act. You're challenged to understand the legal and regulatory bodies that oversee the practice. You're challenged with a lot of things that take place within the state. And you have to figure out what those are and navigate those appropriately. So our first task was to figure out who was responsible for this code that was implemented within the register. So
Mhm.
let's talk about the Louisiana Administrative Code. The code is compiled of rules that are developed and adapted by state agencies, i.e., the Louisiana Board of Nursing is one of them, right? It serves as the final rule in rulemaking. So
Okay.
as these agencies come up with new and inventive ideas or changes to processes that have been documented within the code, the agency then has to perform the procedural or the formal procedure of promulgation. What this does is outlines 5 key steps in the process of getting through the legislature and regulatory bodies within the state of Louisiana. So when you think about challenges and delays in progress and things of that nature, this is where a lot of that time is developed because you can't control what other agencies are doing at this time. So the first thing we had to do was our research, right? We had to gather our data, we had to analyze our data.
And I think it's important to point out that you're talking about doing the research, but in the standards had recommended this practice for quite some time. And I think it's important to point out that even though the standards stated that, we didn't see that change in policy. And that's not to interrupt you, but I wanted to bring that point out that there was a huge gap from the point in which ECG technology recommendation was included in the standards and now moving forward within the scope of practice.
Yes, absolutely. So we noticed a shift in the standards. So we adopted the standards, Dynamic adopted the standards back in
Yeah.
2006. And, they were great for us as an organization and for other organizations to really standardize the care across all organizations. And the physicians loved it too, because all we had to do was show them, here's the research, let's go pull X, Y, and Z, and this will show you what we're talking about right now. And
Yeah.
so it was a great resource for a lot of organizations, a lot of nurses across the organization, because they knew what they were saying, but you always have to have that data to support yourself, right?
Absolutely.
So
Absolutely.
we noticed in the standards around 2011, I think it was, um, that the language changed slightly. It didn't change completely, but it changed slightly. So it used the term confirmed um, radiographically or by further approved technologies prior to the initiation of infusion therapy.
Right.
And then in 2016 was when it actually came in boldface and said, okay, here's today, we're going to use ECG technology. We've done the trials, we've gathered the data, we can support this within the standards. And in 2016, it became published, which we approached the Louisiana Board of Nursing again in 2016. So 2012, 2014, 2016, almost every 2 years, either someone from our team or someone from Louisiana, within the state of Louisiana, was pinging the state board, hey, there's a new standard out here. It's better for patients. We need to look at how
Yeah.
we can make this useful within our community.
And you're talking a little bit about w- why it was helpful or why it makes a difference for the patients. Can we stop here and just talk a little bit about how ECG technology, when confirming a PICC line, how that maximizes the plan of care for the patient?
Yeah. So when you think about the use of technology, at real time bedside confirmation of a tip location with the nurse at the bedside able to see where the line is going, if it's going up the neck, making adjustments at the time, being able to say that this tip of this line is in place when we're completed. At that time, you're finished, you move on, and they can start therapy. So what has it achieved? It has decreased delays in treatment for many patients. Logistical inefficiencies. When you think back to the old ICUs where you had to move the bed, the patient, all the monitors, all the pumps, everything that was attached to them had to go to X-ray just to get chest radiographs to confirm tip location. Like I mentioned, avoiding complications during the procedure. If you're seeing it go up the neck, adjusting at that time rather than waiting for chest
Right.
X-rays. Resource constraints, right?
Right.
X-ray for many years wasn't in-house 24 hours a day. In many larger acute cares, yes, this is accurate. But when you look at long-term acute care, you look at nursing homes, you look at anything outside of the acute care realm, they didn't have access to radiology 24 hours a day. So if you were to place a line at 5 o'clock one day, it may not get cleared until the next day based on when their
Right.
radiology to come and play. So that delays patient care. Patients get unhappy. It keeps them in the hospital longer. They don't want to be there. They want to be at
Right.
home. So a lot of things play a factor when you look at what this technology did for patient satisfaction, for patient safety, and overall for efficiencies within patient care realm.
Right. So you brought all that information forward, and then what happened whenever you presented this go around?
So for this last go around was very exciting. So um, it was very exciting. Previously, the only face-to-face we had with Louisiana Board was in 2012. So in 2023, we re-engaged, we gathered the group up again. Jan Juneau out of Louisiana, Carol Gonzalez, who was our original petitioner, Margaret McCobb, Ann Lockhart, and Rosie Barker, all from Ochsner Health. Then we also submitted to the CNO Council, System Council at Ochsner Health, and utilized the Ochsner Health Vascular Access Service Council. We had Dr. Monique Calmes with the Louisiana Board of Nursing kind of guiding us through the processes. We had many physicians, many nurses throughout the state, many people. And this second go round, we did our due diligence ahead of time. We talked to Carol. We talked about where all of our challenges were and what we really needed to present this time. We gathered all of our data. We went to the Board of Nursing. We presented in person at the Board of Nursing and went through many of the items that we're talking through now, the history, the data that supports this technology, how it can be beneficial. A lot of the questions that were provided to us during that time, we were able to answer because many of us had been using the technology, whether it was approved for final tip location confirmation or not, used the technology for just tracking the tip.
Right.
Tracking the line going into the patient. So everybody was familiar with it, able to speak on its behalf in use, in the clinical use.
Hmm.
And we presented that to the board. We showed them supporting literature. I think we had close to 30 articles that we were able to submit supporting the literature behind it. We had our trusty INS standards with us and showed them
Yeah.
exactly where in the standards and even the
So was this
standards that
was
we're
this in a
moving
big
forward.
room with the whole board in front of you? I mean, I want to soak that in for a second to have everyone really understand what did that feel like presenting all
Let
this
me just tell
data.
you. Let me just tell you. So, there's not without, we're going to talk seriously about a lot of these things, but there's not without a lot of bloopers behind the scenes going on. Okay. Let me just say that.
Bloopers don't occur. What?
We're talking now, we can reflect and say this is what we did, but during the time frame there was a lot of learning happening and adjusting
Yeah,
in
I
real
bet.
time for the board, right? So it's very frightening when you walk in there. I'm not going to sugarcoat it.
Yeah.
Their particular boardroom had a full desk array of desks sitting down, and then a huge wall of people on cameras. So not only were you presenting to the people that were directly in front of you, which was the board, but you're also presenting to anybody. It's an open forum, so anybody
Yeah.
that logged in. I have no idea how many people logged in for that, and I apologize
No,
for,
no, it's
for
okay.
having to.
But you just
Um,
knew that not only the people there were watching, but people were joining remotely as well. That had to be
yes.
intimidating.
Yes, and and it was very much resembled like a courtroom,
Yeah.
right?
Yeah.
With them all across the front. And,
Yeah, I did the LPN program is where I started my nursing journey, and I can reflect on the time that they took us there as a field trip, and
ah,
we went to the Indiana Board of Nursing, and it was the one of the hearing where the petitioners came up to challenge,
mhm,
and also nurses there for disciplinary action. So you heard
mhm,
all of it, and it
mhm,
was a big auditorium, full board on the stage. You know, the individual, the petitioner and or the nurse in question would come to the mic, and I remember feeling bad for the petitioners and or the
y-
nurses in question because the amount of people in that room and how serious it felt, was intimidating, and I felt bad for them, so I'm imagining that same experience and picturing what it was like for you all in Louisiana, so wow.
mhm. Yes, very intimidating. These people are all very advanced in their careers, significant knowledge.
But you did it. You and your team did
But we
it.
got through it. We got through
Yeah,
it. We stumbled our way through it, and they were very accommodating to us. I think they could see that this was not our norm. We're nurses at the bedside, but we went in there prepared, and they did acknowledge that. So we were happy that we did the due diligence we did before we got there.
yeah,
We pleaded our case. We, showed them the data that we had, and we were almost successful that first go around. We had one person that felt like they needed more information.
mhm,
And so that was in 2024. That was October of 2024, actually. And we had somebody that wanted additional information before making a call. And so what we did was, at the request of the board, was there was a PICC task force developed. Now, within that task force, it included board members, it included people from the public, it included clinicians, and legal, I believe, was included in that. And separately, we had a meeting with them, all of the task force committee, and talked through all the concerns that the board was presenting with, all the questions that they had, and all the concerns. Um, After our first meeting, we went back and did a deep dive into some of the questions that we felt we weren't strong with our answers, and really honed in on those questions so that we could give them the supported data that they needed for those
yeah.
questions. And that helped close that gap. And so after that task meeting, we represented to the board again. And at this time, it was all in favor
And
to move
they told you right
forward.
there?
What's that?
They told you right then and there?
They voted right then and there.
Oh, wow.
Yeah, so the first time they voted, we got denied to our face. Second time, we went back to the drawing board, and then we come back and present it again. And this time we took a little bit different approach when we came back to the board, to how we were going to approach it this time.
So so now you're approved. What happens now? When did you find out this? That's
Okay.
really recent,
So,
right?
they approve it the day that you're there,
Okay,
right?
yeah.
So the approval goes through, we get the okay to move forward. That's all that happens. You get
And
the
when
okay
when was that?
to move forward. So this is in February of 25.
Okay, February 25.
February of 25, the Louisiana Board of Nursing decides that, yes, we've got enough data to support this practice, and we're going to go through the promulgation process now. Now, what that entails is a series of events that have to take place before a rule can be changed within the Louisiana Administrative Code. There's about 5 steps that go through this process, and we were following the steps very closely. They do tell you this is a time thing, and it's not going to be anything less than 10 months. And you shouldn't expect anything less than 10 months. And each step, they would, update us on where we were in the process. And one of the steps at the very end is sending in the summary that includes the notice of intent, any amendments, any objections, and then it goes into approval phase. And then once it goes through the approval phase, it is then documented into the Louisiana Register. Once it is documented in the Louisiana Register, it is now official. That was just the beginning. Yes, yay, yay,
That is
yay.
so exciting, Carla. So that
Very, very exciting times. It was a long time coming. Thankfully, Carol was still with us and able to join us to see this come to
yes,
fruition.
thank you, Carol. If you're listening right now,
Yes.
thank you,
And
Carol.
now the hard work comes, right? So now
Right.
that the change in the register, now you have to go back to the facility level and develop policy and procedure and guidelines. So right now that's in full swing. In some of
Yeah.
the locations that requires modification to EMRs, in some locations that requires just a change of policy and procedure. It depends on the organization itself.
Now, Carla, did that change reflect can use or will use? So, is there still an option within the patient's plan of care to use X-ray or ECG technology? Is that how it reads currently now?
Now it doesn't read anything. So what we did was we removed the whole section with regard to PICS and gave it back to healthcare organizations and nursing.
Ah, okay.
We took it out of the law and put it back on the organizations. So, clinical practice will still dictate what happens at the
Mhm.
bedside. There is certain criteria that has to be met, certain training that has to be achieved by whoever's providing these services, competencies developed, those sorts of things. And many of our nurses in Louisiana, at many of the institutions that we work with in Louisiana, we're already utilizing the technology. So the training aspect of it, I don't think is going to be a problem. It's more so the documentation, EMR, those sorts of things that need to be in place. And then the education. We can't forget
Right.
about educating everybody on what to look for. Instead of looking for a chest x-ray, you may be looking for an ECG strip or confirmation through an ECG image or something of that nature.
Right. Right. Lots of validation and competency, not only initial, but, ongoing as well. So
Ongoing as well.
expanding those programs to ensure that, you know, not only are they using the technology, but using it appropriately and really maximizing efficiency and safety of that particular technology.
Absolutely.
Well, that is so exciting, Carla. I really appreciate the change that you've advocated for years, you and your entire team. And it's just so great. And I was excited to talk and bring that to our audience here in the INS Infusion Room, because it is so recent. And there's been a lot of talk, particularly within this season, about change. There's a lot of fear that goes behind change, for nurses receiving change in policy, but also calling the nurses at the bedside to implement change and advocate for change, because that's essentially where it occurs is at
Mhm.
the bedside, identifying a clinical concern and identifying stakeholders to come together and collectively band together to advocate and make the change that's going to positively affect the patient's plan of care. So this is a perfect example of how that can be done. And regardless of how big or small it is, what is your number one advice or words of wisdom you can provide nurses that are listening right now regarding change?
If you're focusing on patient safety using evidence-based practice and you have the literature and data to support, don't give up. Hands down. It could take many years or it could take 10 months. It just depends on what you're presenting and if you have the right team together. You have to have collaboration with others. Many people talk about nursing as being one of the largest industries, and we know that we can make change with numbers, right? So,
Mhm.
joining with other teams to collaborate on this project that we worked on was beneficial. Had we not had the key players in place to move this through the system like we needed to, and at every step, we brought in new players, so the foundation of the players remained. At every step, we brought in new players to learn more, to understand more about where they were coming from, what we could do to make an impact for them, and then used all of that knowledge when we did our presentations.
It was a
Um,
pivot again, pivot back, 360.
it was a lot. I mean, you
Yeah,
know, get your coalition together,
that's
collaborate
right.
with others, engage as many people as you can, be persistent. That was one of the things that, we had to be. And we had to demonstrate value in this change. We had to show that this would be valuable to the people of Louisiana, to the patients that we were caring for. And over time, you just have to be adaptable. You have to
Mhm.
roll with the punches. Just like I said, it wasn't without bloopers behind the scenes, let me just tell you. But we worked together to get it done. And it does take time to get things like that done.
Well, again, thank you. And before we wrap up today's episode, do you have any final thoughts?
Like to encourage everyone to be an advocate for nursing, especially in this day and age where we're challenged with a lot of different things coming at us all at once. Be an advocate because a lot of the times that changes are being made, there may be key points of information that are not being considered. And as minor as you think they may be, saying them out loud may make a difference when you're advocating for something. So I do believe that everyone is an advocate at the bedside. Every nurse is an advocate for their patients. But I do believe that it's important for all of us to get involved. Maybe it's a local level, a national level. Um, Involve yourself with organizations like Infusion Nurses Society. That was and that was one of the key things that changed our direction of practice many, many years ago and supported a lot of our practice throughout the years.
Well, thank you. And with that, we'll wrap up today's episode. And as always, I'm your host, Derek, and it's been a pleasure sharing this important discussion with you all. Remember, knowledge empowers us to make informed decisions. Until next time, stay informed, stay curious, and keep gaining knowledge. Thank you.
Infusion complete.